What if I told you that while brushing your teeth this morning, you had the perfect opportunity to slash your risk of stroke without changing your diet, your meds, or your exercise routine? I've treated seniors for over 30 years, and one of the most overlooked morning rituals could be your greatest weapon against memory loss, brain fog, and even silent strokes. It takes less than 60 seconds. It costs nothing. And it starts tomorrow morning, right at your bathroom sink. Every senior knows brushing your teeth protects your smile, but few realize it may be protecting something far more critical: your brain. Here's what I've seen over and over in my clinic: seniors who eat well, walk daily, and follow their doctor's advice, yet they come in with signs of cognitive decline, early memory loss, and in many cases, small strokes that went completely unnoticed. They're shocked. "But I'm doing everything right," they say. And often, they are. But here's the missing link almost no one talks about: your gums. The health of your gums can either protect the delicate blood vessels in your brain or trigger inflammation that sets the stage for a stroke. Here's why it matters. Your mouth is home to over 700 types of bacteria. That's normal. But when you have gum disease, even mild gingivitis, those bacteria don't just stay on your tongue. They can slip into tiny blood vessels in your gums and travel straight into your bloodstream. From there, they ride along to your brain. And that's where the real danger begins. Studies show that these bacteria trigger a cascade of inflammation in your blood vessels. They activate your body's clotting system. They stiffen your arteries. They weaken the endothelial lining, that delicate inner layer that keeps your vessels smooth and open. In seniors, where vessels are already narrower and more fragile, this is a recipe for disaster. It's not just theory. I once treated a 74-year-old retired vet named Richard. Fit, sharp, never missed a doctor's appointment. But one morning, he woke up with slight slurring in his speech and a heavy arm. A scan revealed a small ischemic stroke had occurred overnight. His blood work showed elevated inflammatory markers, not from diet, not from cholesterol, but from an overgrowth of oral bacteria. His dentist confirmed moderate gum disease, the kind that doesn't hurt, the kind you don't even notice, until your brain pays the price. So what can you do? Here's where it gets exciting. Research from the University of Louisville and other major institutions has shown that a very simple technique, one you can start tomorrow, can dramatically reduce the bacterial load in your mouth and lower markers of inflammation in your bloodstream. It's called gum line stimulation breathing. You don't need to remember that name. You just need to do this every morning while brushing your teeth. As you brush the outer surfaces of your teeth, gently close your lips around the brush and breathe through your nose. Slow, deep breaths. Try to relax your shoulders. This activates your parasympathetic nervous system, your body's natural calm mode. Then, for just 30 seconds while brushing your lower teeth, gently massage your gums in small circles with the bristles angled at 45 degrees. Not aggressively, just a light stimulation. This does two things at once. It disrupts bacterial colonies hiding under the gum line, and it triggers blood flow to the vessels in your mouth and face, which helps flush out inflammatory compounds and reduce blood clotting factors. In other words, it clears the mouth and signals calm to the brain. Now, does this replace medication? Of course not. But when practiced daily, especially in the morning, when clotting risk is highest, it acts like a gentle circuit breaker. It stops inflammation before it starts. Richard started doing this every morning. Within 3 months, his follow-up labs showed lower systemic inflammation. His brain scans stayed stable. Most importantly, his wife said his energy and focus returned, and so did his confidence. You don't need a new supplement. You don't need a new gadget. You just need to breathe deeply and stimulate your gums for 30 seconds while brushing. It's that simple. Tomorrow morning, when you stand in front of the mirror, don't just brush for your teeth. Brush for your brain. Here's what too many people get wrong. They think strokes are only caused by clogged arteries in the neck or heart. But some of the most devastating strokes I've seen in seniors were traced back to something much smaller, something that began in the mouth. Let me explain. When you have even mild gum disease, your body doesn't just treat it like a tooth problem, it treats it like a full-body infection. That means your immune system goes on high alert, day after day. This constant alert triggers what we call systemic inflammation, a low-grade internal fire that spreads silently through your blood vessels, including the ones that feed your brain. Think of it like this. The bacteria hiding in your gums don't just stay there. They seep into your bloodstream and hitch a ride. Once inside, they trigger damage at every stop, especially where blood vessels are already weakened by age, blood pressure, or cholesterol. And here's the kicker. Most of that damage happens at night, while you sleep. Your blood naturally thickens slightly during the early morning hours. Combine that with low-grade inflammation from untreated gum disease, and what do you get? The perfect storm for a clot to form and lodge in a tiny artery in your brain. That's why so many strokes occur between 4 a.m. and 9 a.m. That's why what you do in the morning matters more than you realize. I remember a woman named Karen. She was 72, retired and healthy by all traditional measures. Didn't smoke. Ate well. But she came into my office after waking up with numbness in her cheek and difficulty forming words. Her scans showed a small embolic stroke. Her blood pressure was fine, cholesterol borderline, but her inflammatory markers, CRP and fibrinogen, were elevated. When we talked, she mentioned bleeding gums when brushing, but said she just assumed that was normal for her age. Her dentist later confirmed moderate periodontitis. The bacteria in her gums had likely traveled to her bloodstream and contributed to vascular inflammation in the brain. A silent process, until the morning her speech vanished. Karen now tells everyone she knows, "It wasn't my heart that gave out. It was my gums." And she's right. The vascular system in your brain is incredibly delicate. It depends on a smooth, unrestricted blood flow to function. But when oral bacteria and inflammation are present, your vessels become sticky. Clots form more easily. Oxygen can't reach your memory centers, your balance system, or your language pathways. That's not just science. That's stroke risk. Now here's the hopeful part. When you disrupt that inflammation early, right when you wake up, you reduce your risk before it even has a chance to build. That's why I urge every senior to treat toothbrushing not just as hygiene, but as vascular therapy. When you breathe deeply through your nose while brushing, you activate nitric oxide production in your nasal passages. That improves blood vessel elasticity. When you stimulate the gum line with a soft brush, you don't just clean. You increase circulation to oral tissues and prevent the bacterial biofilm from entering the bloodstream. And when you pair this with staying hydrated and eating an anti-inflammatory breakfast, you create a morning cascade of protection that lasts for hours. It's not about perfection. It's about daily rhythm. Brush, breathe, massage your gums, calm your nervous system. Let your blood flow the way it was meant to, smooth, clean, and oxygen-rich. I tell my patients this all the time. You don't need to buy time. You just need to stop giving it away. And the bathroom mirror is where it starts. Let's zoom out for a moment. What if your entire morning routine, just the first 5 minutes, was quietly shaping your brain's future? Most seniors think stroke prevention requires dramatic lifestyle overhauls. But the truth is, some of the most powerful changes come from what you do between waking up and walking into the kitchen. Brushing your teeth when done mindfully can be a neurological reset button. Here's how I want you to think of it. You wake up. Your blood is naturally thicker from the night's sleep. Your vessels are slightly constricted. Your brain is slowly reactivating. This is a fragile window, and if you don't manage it right, small clots, spikes in pressure, and inflammation can build before you even pour your first cup of coffee. That's why what you do while brushing isn't just dental hygiene, it's stroke prevention. So here's how to elevate it into a ritual that protects your brain. First, drink a glass of water. Before brushing. Before anything. Just a small glass. 8 ounces. It thins your blood, wakes up your kidneys, and starts restoring healthy circulation. Then go to your mirror. As you brush, take long, steady breaths through your nose. This signals calm to your nervous system. It lowers cortisol, improves heart rhythm, and boosts nitric oxide levels. That's the gas that relaxes and opens your arteries. Next, tilt your brush to a 45-degree angle and gently sweep along your gum line, especially the bottom row. This isn't scrubbing, it's stimulation. The goal isn't force, it's flow. You're clearing the bacteria and sending microsignals to your capillaries that say, wake up, move the blood. If you want to go a step further, try this. While brushing the outer teeth, lift your heels slightly off the ground and then lower them. A few repetitions. This simple heel raise engages the calf muscles, your second heart, and helps push blood back toward the brain. It may sound odd, but this kind of micro-movement activates circulation in a profound way, especially in seniors with slower morning blood flow. And don't forget the mindset shift. This is your reset moment. Say a few words of intention, something like, I'm clearing the fog, I'm circulating healing, I'm protecting my brain. Because the brain isn't just waiting for a pill, it's waiting for oxygen, for nutrients, for calm blood flow, and a clear path to do its job. I had a patient named Harold, 78, former jazz pianist, still sharp, but struggling with occasional dizzy spells in the morning. We ruled out major causes, and then I asked, tell me about your morning. He said he brushed quickly, skipped breakfast, and usually rushed to take his blood pressure meds with coffee. I gave him a 5-minute morning prescription. Drink water, brush slowly with gum stimulation, breathe through his nose, and stretch lightly after. 3 weeks later, his dizziness was gone. His balance improved. And best of all, he said, it feels like my brain wakes up smoother now. That's what I want for you. A smooth start. Not a rushed one. Not a stressed one. A 5-minute window where you take charge of your blood flow, your breath, your bacteria, and your brain. The power isn't in doing more. It's in doing what you already do, just with intention and a tiny shift in technique. Brush like your brain depends on it, because it does. George never thought brushing his teeth would be the moment that changed his life. He was 76, a retired postman, proud of his morning routine. Up by 6:30, brushed his teeth, walked the dog, and made oatmeal with fruit. He didn't smoke, rarely drank, took his meds on time. A model senior, by most accounts. But one morning, he stumbled in the kitchen. Not dizzy, just off balance. His speech felt a little slow. His right hand fumbled the spoon. His wife noticed. She called their doctor, and within hours, George was in my office. His scan showed what we call a lacunar infarct, a small silent stroke in the brain's deep tissue, the kind that doesn't knock you down, until one day it does. He was stunned. But I've done everything right, he told me. And he had, mostly. But when we talked deeper, one habit stood out. George had mild gum disease, bleeding gums in the morning, some tooth sensitivity. Runs in the family, he said. He brushed every day, but quickly. Never flossed, never stimulated his gums. His dentist had warned him, but he didn't think it mattered much. But here's what I knew. George's body was quietly inflamed. We ran blood work. His CRP levels, an inflammation marker, were elevated. His fibrinogen was high. His blood was stickier than it should have been. And his stroke? It didn't come from cholesterol. It came from the low-grade fire smoldering in his bloodstream, fueled in part by bacteria leaking from his gums every single day. That's when we made the shift. I told George, we can't undo the stroke, but we can stop the next one. We gave him a new morning protocol. Water first, deep nasal breathing while brushing, circular gum line massage with a soft brush and a slow, mindful pace. At first he thought it was silly. What's a toothbrush going to do for my brain? But within 2 weeks, something shifted. He felt sharper in the mornings, less foggy. His balance steadied. His wife said he smiled more, moved easier, laughed quicker. His dentist saw a massive reduction in gum inflammation, and his next round of blood work, inflammation markers, down, platelet stickiness, lower. George had turned brushing his teeth into a daily act of prevention. No fancy treatments, no extreme diets, just consistency, just intention. That's what I need you to understand. Your mouth is not separate from your brain. It's directly connected through blood, nerves, and immune response. What you do at your sink each morning can either inflame your vessels or heal them. You get to choose. George chose healing, and so can you. Don't underestimate the power of what happens in the first few minutes of your day. Your brain is listening. Your blood is responding. Your future is forming, right there in front of the mirror. So tomorrow morning, when you reach for that toothbrush, slow down, breathe, stimulate your gums, hydrate, move your body gently. Tell your nervous system, I'm here, I'm safe, I'm healing. Because the difference between a minor stroke and a major one often comes down to daily blood flow. And blood flow, my friend, begins with breath, with hydration, and yes, with your gums. There's no pill that can replace this, no supplement, no superfood. Because what you do tomorrow morning, before you even swallow your first bite, has the power to rewire your brain's destiny. It doesn't come with fanfare. It doesn't feel like a miracle. But when you rinse your mouth, breathe through your nose, and sweep gently along your gum line, you're choosing to clear the path for oxygen to reach your memory center, the path for smooth blood to feed your focus, the path that says, I still have years to live well, and I won't let a preventable stroke take them from me. It's not about being perfect. It's about being aware. You brush your teeth every day already. Now, let that habit become your morning medicine. Your nervous system will thank you. Your arteries will soften. Your brain will begin to breathe easier. And here's the part no one ever tells you. The brain doesn't ask for much, but it remembers everything. It remembers the morning inflammation never came. It remembers the clots that never formed. It remembers the day you decided to protect it with a toothbrush and a breath. So try it tomorrow. Try it for 7 days. And if you feel even 5% clearer, steadier, more you again, then you'll know. You'll know your brain was listening. You'll know your blood was flowing. You'll know you gave yourself something that no medication can match, a second chance, every morning, in 60 seconds.